Black Maternal Health Week, a time to highlight the disparities in healthcare and work to improve the birthing experience for women. Joining us now is Monique Shaw, Senior Program Officer at Robert Wood Johnson Foundation. Thank you so much for joining us. We appreciate it.
Thank you so much for having me.
So, very important topic. Want to get right to it. We know Black women experience maternal mortality at higher rates. How is Black Maternal Health Week working to drastically reduce that number?
Yes, Black Maternal Health Week is such an important time in our country, especially because of the decades-long maternal health crisis that you speak of. And there are so many people, so many advocates, so many professionals that and communities that are coming together during this week to raise awareness about issues around maternal health and Black maternal health in particular, and then also to lift up solutions, community-driven solutions that have been found to be really helpful to addressing this crisis and improving outcomes.
It's timely, it's heartbreaking, but most recently, a longtime Kansas City Chiefs cheerleader died from complications from birth. We've heard about high-profile athletes and entertainers also experiencing complications. What is so unique about Black maternal health that women, kind of regardless of socioeconomic status, are experiencing similar things?
Yeah, well, first and foremost, it's important to say that everyone, no matter their background, no matter their socioeconomic status, no matter their race, should have safe, respectful, and dignified care and treatment, and the care and treatment that they need in order to have healthy pregnancies and healthy babies, despite our current systems not supporting these healthy outcomes for everyone. And as you mentioned, it really doesn't matter what your socioeconomic status is and what access you have to being a higher profile individual. We're seeing that Black women and other birthing people of color across this country are still disproportionately impacted by this crisis. So much so that the maternal mortality rates for Black women are anywhere to 3 times that of their white counterparts. And I think what's really troubling about these statistics in particular is that the vast majority of these deaths are preventable. And so that makes each and every death not only tragic, but also inexcusable.
Yeah, 3 times, just a staggering statistic there. You've heard a lot in recent years, I'd say in the last 5 to 10 years, more and more women leaning towards home births, getting doulas. I mean, back in the day, people might not have even known what a doula was. And so we've had a little bit of a change within this demographic. Do home births have safer delivery rates?
Yes, well, we definitely know that people are transitioning to having more out of hospital births. And the reality is that we should be providing access to care across the full reproductive spectrum in all places where care is provided. And it's really important for us to ensure that care is integrated. And so we have an integrated approach. So doulas can provide physical, spiritual, and educational resources and care across the prenatal and birth journey. We also want to uplift midwifery models of care, as midwives are medically trained individuals who provide low-risk medical care for patients from pregnancy to birth and throughout the postpartum period, which is where we actually see a lot of these inequities exacerbated. And so both midwives and doulas and birth centers and other perinatal health workers and supports for women are wraparound supports that are essential and should be accessible for everyone to improve outcomes.
Now, along the same lines here, I'll be fully transparent, I didn't realize this is as much of a thing as it is, but in researching this topic, more women going abroad to give birth. Do you think that there's a connection, a tie there with the growing fear surrounding maternal mortality?
Yeah, it is absolutely a growing fear around maternal mortality. And it's really unfortunate because this is such a special time and should be a special and joyous occasion for people and their families. It's important, however, not to let these alarming disparities really obscure the joy and magic of childbirth. New life coming into the world is such a blessing, and supportive maternal and infant health supports are one crucial way to make sure that childbirth remains joyful and remains the magical moment that it should be. So our focus should be on figuring out how to better support women and birthing people across their journey.
I do want to end on a bright spot here. What are some ways that moms and their families can advocate for themselves? Any advice from you that women can incorporate during their birthing journeys?
Absolutely. Advocacy is so incredibly important, and make sure that you consider bringing in support either from a doula, a perinatal health worker, a family member, or even a friend who's committed to advocating on your behalf. Ensuring that your priorities are met, and really helping you communicate your symptoms and needs so your birth can be the joyful moment that it should be. Also, trust in your own knowledge and the knowledge of your body. Know what your preferences are, make sure that they're communicated, and really search for a provider or a practice that feels right and where you feel treated with dignity and respect.
Mamas out there know when you have that baby, you are so focused on their health, their safety and security. The last thing in your mind is your own care and the quality of that care. Monique Shaw, thank you so much for your insight and your advocacy work. We appreciate it.